All right, welcome back, everybody. For those of you who don't know me, you should by now, I guess. I'm Captain Logan Daniel, National Registered Paramedic, Flight Paramedic with Advent Health Gordon. I'm coming to you from my living room. We've got Joint Commission today at our headquarters station where my office is, so had to kind of improvise. If you see this video on YouTube, just do the YouTube rules and regulations, we'll say. It'll be called How to Unalive Your Trauma Patient, Hypothermia. So this is a PowerPoint that I made up to go along with this class. Something I feel pretty passionate about as a paramedic. We're in a very rural area. We do have quite a few lakes and rivers, that kind of thing. So with our trauma patients, I feel like this is a super important topic, especially for our new paramedics and EMTs that might get a little overlooked as they're going through school. So this is something that I kind of harp on students that I have and that kind of thing. So without further ado, it's how to kill your trauma patient, hypothermia. So hypothermia, it's a cold reality, right? Hypothermia is defined as the core body temperature of approximately 36 degrees Celsius and below. So that's 97 degrees Fahrenheit for us Americans. Now, granted, there are some differences in everybody's body temperature. We're not all running exactly 98.6 like school teaches you sometimes. 3 stages of hypothermia: mild 36 to 34 degrees Celsius, moderate is 34 to 32 degrees Celsius, and severe is less than 30 degrees Celsius. We'll kind of dive into each of these, some of the effects, the pathophysiology behind that. But leading to our next slide, we're human beings, right? We're not polar bears. We do have certain ways that we can thermoregulate, control our body temperature and that type of thing, but we're not like Mr. Polar Bear here with 2 inches of fat and a layer of fur. I think some of my patients might be, just looking at them, but I'd say for the general population, we're not. So what does hypothermia do? Okay, it increases the mortality of our patient, especially those that are acutely injured. So our trauma patient, which is what this particular PowerPoint kind of focuses on, is our trauma patients. But that's not to say that our acutely ill patients, our septic patients, our little old ladies that just have a really bad UTI, they're all susceptible to hypothermia, right? So as the disease process or illness or injury processes occur, so does the occurrence of hypothermia, right? And we'll kind of delve into the why that happens. But in other words, the more injured you are, the more blood loss you lose, or have rather, the greater your chances or risk for hypothermia. So that just as a whole increases your mortality, increases acidosis throughout the body, can increase your severity of your injury, right? It increases your ICU stay, admission, chances of being admitted to the ICU, in other words, and your days on ventilator support if you have an injury or illness that warrants that. So usually, as you see right here, there's usually approximately a 99% chance of death with a core body temperature of less than 30 degrees Celsius, regardless of your treatment. Now, that's not always the case. I know we've all probably seen the thing going around on social media talking about, oh, there was a lady found basically frozen solid. She was worked, with all ACLS protocols, and she actually made a full recovery. That's not what we're talking about here. We're talking about injuries and illnesses, right? So our mechanisms of thermoregulation as human beings. Okay, we basically have 2 ways that our body kind of automatically regulates, right? The peripheries get hot or the peripheries get cold, right? Peripheries get cold, we detect it in our hypothalamus. Our capillaries vasoconstrict, they get smaller, and those are the ones near the surface of the skin, right? That kind of directs blood away from the skin to preserve body heat, right? We have hairs, our piloerector muscle. I'm sure we all learned that in paramedic and EMT school. Our piloerector muscle causes our hairs to stand up, right? That actually increases surface area, kind of traps that body heat. That's why our mammals, like we saw the polar bear, can stay a little bit warmer than we can. We're basically hairless primates, right? On the other end of the spectrum, when we get hot, our peripheries get hot, our capillaries can dilate at the surface of the skin. That helps us to lose body heat. We kind of, not off gas, but just off put heat, so to speak. We start sweating and we have heat loss via evaporation, right? So pretty self-explanatory. And our bodies are constantly adjusting this, right? We're super complex beings. Our brains are constantly trying to keep us alive, to regulate. So again, just to kind of recap on everything, it's activated by our exposure to cold or hot, either one. So we call it, in a general sense, reflex vasoconstriction. Okay, it stimulates the hypothalamus. A couple other heat preservation mechanisms that we have as human beings: shivering. We have our adaptive behaviors. So, in other words, I go outside. It's cold. We have really cold winters in North Georgia where I am, and I put on another jacket, right, or another shirt, so on and so forth. I go outside. It's super hot. Probably going to take my shirt off. And then we have our autonomic and endocrine responses. So in other words, sweating, or talking about the hair standing up on our arms, that kind of thing, okay? So how does this affect the trauma patient, cold specifically? We have cold diuresis, right? That in a nutshell is just peripheral vasoconstriction that results in our fluids within our vascular system shifting into the intravascular space, right? So in other words, the fluids are no longer where they need to be. And that's just one of the reasons why it can cause mortality or increase mortality in your trauma patient. Already have a fluid loss, and then we have fluids that shift to where they're not supposed to be. Neurological wise, obviously if our fluids shift, we have a drop in cerebral blood flow. Our brain is not being perfused as it should be. So some of your clinical signs that you're going to see: increased confusion, impaired judgment, altered level of consciousness, so on and so forth. And we see that, quite a bit in our trauma patients already. So how does it kill them? Okay, it results in a direct decrease of coagulopathy. Okay, we have enzymatic functions. There's clotting factors, and basically our blood can no longer clot correctly. Among other things, our body cannot as effectively metabolize certain medications, that kind of thing. But generally speaking, it decreases the enzymatic function that allows our blood to clot. And we notice some of these effects starting at around 35 degrees Celsius body temperature. Just some of your physiological effects. So a mild hypothermia are 95 to 89.6 degrees Fahrenheit. I kind of changed it around a little bit on you just to make it easier to understand. I went to Fahrenheit since we are Americans. We use Fahrenheit most of the time. So mild, you have a catecholamine release, increased ventilatory rate, our cold-induced diuresis that we're talking about, some confusion, that type of thing. Moderate, our decreased metabolic rate, decrease in oxygen consumption, our enzyme suppression, our clotting factors no longer work. A nervous system reduction, everything kind of slows down. Decreased ventilation rate, and I just put stupor. I think we all know that doesn't mean you're stupid. It just means that you're kind of acting not quite in a coma, but close. Our severe, you start developing your metabolic acidosis, increased cardiac irritability, VFib can lead to VFib, severe hypotension, decreased or absent ventilation, of course, hyperkalemia, and coma. Profound body temperature less than about 68 degrees, usually death. So causes of decreased heat production. So our tissue oxygenation, tissue perfusion limited by shock. Pretty self-explanatory. No perfusion of tissue, no body heat, i.e. traumatic amputation, that kind of thing. Can be caused by hypovolemia, so with our trauma patients, again, bleeding out. And our shivering can be inhibited during an episode of hypotension or hypoxemia. In other words, our brain is not being perfused enough to know to shiver. Fairly self-explanatory. And a lot of my PowerPoints or presentations that I do, I try to include something called an EMS Pearl. And it's just little pearls of wisdom, if you will. I don't know if I made that up or not. I probably saw it somewhere. I've been doing this a while. So what are we supposed to do when we do have a trauma patient of any kind? It doesn't matter, if it's in Georgia, North Georgia, like I said, cold winters, hot summers. I mean hot summers, like 100 degrees, hot summer. Wintertime, 30-degree highs, especially up here in the mountains. So this is kind of just a generalized if you have a trauma patient. If you do have a trauma patient, place them in a warm environment, okay? Get them out from the weather, place them in the back of your ambulance, okay? Remember, you can go back to your station and change clothes. They might not get that option, okay? If you get hot, cold, whatever, you can always correct that eventually. Remove their wet clothing and replace that clothing with a warm and dry blankets, right? Our ambulances, our helicopters, we carry a blanket warmer. It's literally a Domino's pizza warmer. That's much more expensive, right? It warms our blankets. It's awesome. Warm fluids. You should always, 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 always be giving your trauma patient warm fluids. Warm fluids decrease the risk of that decreased clotting cascades, our enzymatic functions, that kind of thing. Always, always, always give your trauma patients, your acutely ill patients, warm fluids. Just kind of some common sense, but some people don't do this. Use your full blanket first. Now we carry a few different types of emergency blankets. One of them being the full bunting blanket. We carry kind of a plastic one that's waterproof as well. So either one of those, your full blanket first, kind of reflects some of that body heat. And then on top of that, our warmed blankets or clothes. So our treatments for some of our trauma patients. Well, we kind of just covered that, but we're gonna go through it just to solidify everything that we've learned. So step one, take their temperature, right? I'm aware not every ambulance carries a thermometer. We're very blessed with our equipment. We do carry thermometers. We carry the rectal, I'll be honest, I've never used, but our oral or axillary thermometers. So take their temperature, okay? That's gonna be your biggest indicator on, hey, this patient might be a little cool, even if they're not saying, right? Step two, our warm fluids increases your overall patient outcome, and it can help to maintain those hemodynamic stability issues. We know with our trauma patients that are hypovolemic, ultimately they need blood. We don't carry that. Most places in the state of Georgia don't carry blood on their ambulances. We do on our helicopters. We carry whole blood. Most ambulances don't. The warm fluids, they help to maintain the body temperature just by being warm. It does increase and kind of normalizes our drug metabolism if medications are necessary. And it can decrease, I'll say can, decrease hemorrhaging by raising your clotting response, your clotting cascade. So in conclusion, with our patients, hypothermia kind of decreases our enzymatic functions of the clotting cascade, and you can really see if you do labs, you can see this in prolongation of your PTT, your prothrombin time, your clotting time in a laboratory test. So keeping your trauma patient warm can drastically improve their survival outcome. And remember, like I said earlier, you can always change clothes if you get sweaty. Your patient might not be so lucky, right? So this has just been a short PowerPoint on how to unalive your patient. In other words, how to kill your trauma patient, how if by hypothermia, by not keeping them warm. Hope you learned something. If you got any questions, don't hesitate to reach out. Hope you guys have a great day. Stay safe.